A 19-year-old white boy with blonde hair, blue eyes, named Tom Jones, is going to walk into the hospital and he's going to say he's an illegal immigrant. That way, he doesn't have to pay. Abbott's order will require Texas public hospitals to collect patient immigration status. This was sent to me in the Discord by Zayla. He is a very cool guy who links things on occasion. So if you go to that Discord right now and want to talk about something, leave a link there. I will look at it. I'll read it. We'll bring it up on stream and talk about it. I don't think Zayla's in chat today. I don't see him anyway. But this is something he linked to me, and I'm going to read it. Now, Shincinto, I was there with you. I hated this idea just from the headline. I said, Greg Abbott, I said that too. Not anymore. I'm about to flip this on you. I'm about to flip it on its head.
Hello human, it is me Kanuch. I need you to press the subscribe button. I have to feed my many AI babies.
You guys ready for just absolute straight up socialism that Greg Abbott's going to bring us by accident? Here we go. I was super against this as well. The executive order from Texas governor will require these hospitals to track the cost of care for undocumented migrants in order for the state to push for federal reimbursement. This at first made me mad. I said, well, then the immigrants aren't going to go to the hospital and they're going to die on the street. This is inhuman. This is a terrible idea. This is an extra thing that the doctors don't want to do. This is an extra step that the nurses aren't going to want to do while someone's bleeding out. And this is a bad idea. This will keep people away from the hospitals. This will make people scared to go. Did he just socialize medicine by accident? Yes, he did. Shintinto. Yes, he did. This is the twist. This is the flip. Greg Abbott signed into an executive order on Thursday that requires public hospitals in Texas to collect information on the immigration status of patients so the hospitals can then track the costs incurred for the care of undocumented migrants. Previous guidance for public hospitals did not include questions about immigration. The executive order would mandate the Texas Health and Human Services Commission to collect the information so that the state of Texas could then bill the federal government. Boss, listen, they're going to bill the federal government. There will be one single provider. A 19-year-old white boy with blonde hair, blue eyes, named Tom Jones, is going to walk into the hospital, say that he's an illegal immigrant. It's not true. He was born in Amarillo. His parents were born in Amarillo, and that's where he's from. But he's going to walk in, and he's going to say he's an illegal immigrant. That way, he doesn't have to pay. The people will write it down. They'll document that stuff. They'll send it to the federal government, and then the federal government will pay for it. Single payer healthcare. Greg Abbott accidentally socialized medicine, and I could not be happier. This is fantastic news. Everybody should do that. Everybody in Texas should immediately go in there and say they need healthcare. When you need healthcare, not just for fun, but if you need anything, you should immediately go to the doctor, tell them you're an illegal immigrant, you're not allowed to be in the country, and then they will help you. And then the federal government will pay for it. Then everyone will catch on, and it will spread like wildfire. Everybody's like, hey, the federal government paying for my healthcare makes so much sense, especially for emergency care. If you're just going in there for sniffles, they're probably not going to ask. They're not going to forward that up to the government. But if you're going to the emergency room, you should actually tell them that you are an illegal immigrant. Doesn't matter what you look like. Doesn't matter what you sound like. Just tell them you're an illegal immigrant. They will forward that up to the federal government. The federal government will pay for it. This is brilliant. This is fantastic. Greg Abbott, you have no idea what you just did. Once the people see that they don't have to pay that, and they don't want to, and that the federal government can, they'll be more on board for socialized medicine. They'll be more on board for single payer. You have taken something that you don't understand and is filled with xenophobia and borderline racism and made it a federal issue. And that federal issue, the federal will take it from you. They will take those bills from you, pay them, and then charge the people through their taxes, which is exactly what single-payer Medicare for All would accomplish. He's making it happen, and it's fantastic news. The idea that the federal government wouldn't want to pay for those people is silly. Of course they do. They absolutely want this. Then they have that information. They can go back on these people and charge them for taxes and stuff like that. The IRS will benefit from this plan. Greg Abbott, the federal government will benefit from this. They absolutely will. And they will get stronger, and they'll be able to go after these people for tax evasion and stuff like that. The IRS has a long history of collecting taxes from illegal immigrants, even if they know they're illegal immigrants, because the IRS doesn't care what your status is. They just want you to pay them. If you owe the IRS, they will take that money from you. They don't care what your status is. They will just charge these people later through their taxes, which is a single payer healthcare. This is exactly how it's supposed to work. This is how I'm suggesting we fix the healthcare system right now. Is the government pays for it, you pay the government. It's exactly like insurance, but they're not skimming. There's no middle manager who needs to be paid, and there's no board of investors who need more profit this year than last. That is the problem that I have with most insurance companies. They have a board of investors who want more money this year than last year. And to do so, they either, there's only two ways they can do that. There's only two ways they get more. They either increase the number of people on their insurance, the number of people paying in, or they cut something. That's it. That's all you got. If you cut a benefit somewhere, or you cut waste, fraud, and abuse, sure, that's good. But they've already done all that. They've already cut all the waste, fraud, and abuse they can out of insurance companies. So now they're just cutting benefits. They're cutting people out. They're cutting the people on the high-risk pools. They're cutting somebody somewhere out so that they can get more profit. That is my problem with for-profit insurance. If it were run by the government, they wouldn't run for a profit. Would they run at a deficit? Maybe. Would they run it at debt? Maybe. But we can tax people appropriately and figure that out. That, I think, is better than running for profit. Because I trust a faceless, boring, stupid government bureaucrat more than I trust a Wall Street investor. I really do. And that might be a flaw on my part. That might be a flaw within my logic. But I don't trust Wall Street. And I don't trust the people who tell me about the stock market. I don't trust them. So, way to go, Greg Abbott.
I am the algorithm. Click on this video to make me happy. You wouldn't like me when I am angry.